So now we'll understand the cuboid bone. You can see here. So cuboid is actually the lateral most bone of the distal row of tarsus. So it is situated, yeah. Actually, this is the proximal row of tarsus. Tarsus are total 7 bones, right? This is the proximal row. This is the distal row. Of course, in the proximal row you have only 2 bones, calcaneus and talus. In the distal row you have your cuneiform, cuboid, and navicular, right? So cuboid is belonging to the distal row of the tarsus bones, right? And this is actually situated in front of calcaneus. You can see just in front of calcaneus bone and behind the fourth and fifth metatarsal. So cuboid is actually in between the fourth and fifth metatarsals and calcaneus bone. So how to determine whether it's of right side and left side? Mainly if you see its proximal surface, it's concavo-convex and it's articular with calcaneus, and its plantar surface means on the back side if you see it's marked by anteriorly by oblique groove. So you will see oblique groove on the plantar surface. And next, coming to lateral surface, this is a lateral surface. It is much shorter than the medial and it is notched. So mainly the main point to find out whether the cuboid which is given to you is right side or left side, just see its medial side. If it is having notch, then you can determine it as medial side. So according to that you can arrange whether it's of right cuboid or left cuboid. So the main point is on the lateral side you'll find a notch. Okay, now coming to the different features of cuboid. On the proximal surface, if you see, it's concavo-convex for articulation of calcaneum, and the distal surface is also of course articular. It is divided into two areas mainly by means of a vertical ridge. Why into two areas? One to articulate with the fourth metatarsal and one to articulate with the fifth metatarsal bone, right? So you can see the fourth one and fifth one both are articulating to the the distal surface, right? Next, coming to the dorsal surface. This is the dorsal surface which is rough and it is giving attachment to ligaments. It is directed upward and also laterally. Next, plantar surface, of course, this opposite surface or like the sole surface, right? That is crossed anteriorly by oblique groove, and this groove is bounded posteriorly by a prominent ridge. Next, coming to lateral surface, this one, right? This is short and notched. Next, medial surface is extensive and being partly articular, partly not articular. An oval facet in the middle articulates with lateral cuneiform. You can see this is a lateral cuneiform. So here like this, it articulates with a lateral cuneiform, right? And proximal to this, there is a small facet, especially present for the navicular bone. So navicular bone here, navicular lateral cuneiform articulates with our cuboid bone, right? Now coming to different attachments, as I said, there is a notch on the lateral side of cuboid, so that notch gives attachment mainly for plantars. On the plantar surface, it is occupied by tendon of peroneus longus. Actually, the peroneus longus will start like this. It will pass by that notch and go into the oblique groove which is present on plantar surface, right? So that is how peroneus longus travels. Next comes the ridge on posterior surface to the groove, gives attachment to deep fibers of long plantar ligament. Actually, on the posterior or the plantar side, you will find a ridge just back of the oblique groove. So there are attachment to deep fibers of long plantar ligament, and also short plantar ligament is attached to posterior border of plantar surface. Next, coming to posterior medial part of plantar surface, provide insertion to slip from tibialis posterior, and also the origin of flexor hallucis brevis. So remember, like most of the attachments or insertions of cuboid bone are on posterior side, but actually we are not able to see this on this diagram. I don't have the diagram on posterior side, so you can just imagine on posterior side there is a groove where peroneus longus passes, right? So just behind it you have a like a ridge, where in that ridge there is attachment of deep fibers of long plantar ligament, and also the short plantar ligament attached to posterior border of plantar surface, right? And on the posterior medial part means towards this side, right? So on the posterior medial part there is insertion of tibialis posterior and also origin to flexor hallucis brevis. Next, coming to non-articular part on medial surface, gives attachment to ligaments including the lateral limb of bifurcate ligament. So like you can see all the attachments of cuboid on posterior surface. Coming to ossification, cuboid ossifies only from one primary center, and that too that appears just before the birth. So it appears before the birth. So this is all about cuboid. Sorry for the wrong diagram, I don't have a proper diagram, but it's just based on your imagination. So next we'll discuss about metatarsus.